I'm going to show you today how to cut off a cast off a pediatric patient. So there's a couple things with the cast saw. Obviously it's a saw, so it's intimidating. It makes a lot of noise. And so for kids, it can be traumatic. So I try to teach them, or at least tell them a little bit about the saw. If they're really, really young, like, 2 or younger, it's kind of difficult. You kind of just maybe tell the parents more than anything. But one thing I can say for sure is do something to kind of mute or muffle some of the sounds. That'll help to remove some of the fear. So we're just gonna put these headphones on, okay? It's just gonna make everything a little more quiet, okay? So any headphones will do. I mean, these are just from like a hardware store. You can use some old headphones, like Beats or whatever you have. But these are just a pair that we just use in clinic. The other thing I'll do is show the patient that the saw itself doesn't spin around. It doesn't circulate. It actually just oscillates. It shakes back and forth. It cuts against resistance. So your skin is going to shake with it, but the cast itself, it's going to cut right through. The padding is going to shake with it. The stockinette will shake with it. The one thing you want to avoid, then we keep this between ourselves, is that bony prominences. If you hit a bony prominence, it could, if it was unpadded, could potentially like hurt your patient. So we want to be careful of that. The other thing is when you're cutting with a cast saw, you want to hold as close to the blade as you can to control the blade. I know that some people, I'll see them, they're afraid. So they're like, oh my God, get this thing away from me. So, I see them do this. It's no good. You have no control of it at all. So the closer to the blade you hold, the better. The other thing is too, because it's oscillating, it's going back and forth, it's already creating friction, which in turn creates heat. So we want to just go quick up and down, up and down, up and down, up and down motions. Follow the last cut that you had. And when you see me doing it, it may look like I'm dragging. I am not. I'm just going up and down very quickly. So that will really help to make the cast removal a lot quicker. The last thing and a suggestion that I can make is if you have a zip stick, that would be great. It's just a thin plastic strip that can be kind of shoved, for lack of a better term, in between the stockinette and the patient's skin. And that way you can even tell the kids that the saw will hit that before it even gets anywhere near you. So that's kind of helpful. If you don't have something like this, you can kind of try to cheat your way through with some tongue blades. A lot of times I'll even kind of shove my own hand in there to kind of block. It's just vibration mostly. But you do want to make sure too, when your kid comes back into the clinic, that they haven't ripped any of the stockinette or pulled any of the padding out. If they have done that, they are at risk to be cut or burned by the saw. So make sure you have a protective barrier between their skin and the saw. But she's good because she's got the stockinette and the padding, right? You can also use like a very thin ruler, plastic ruler, or something flexible and thin. Make sure it has smooth edges. You wouldn't want anything with sharp edges trying to shove it in there that can cut or hurt your patient as well. So use your best judgment, but those are some things that help, and then try to move quick. That's the final thing. Are you ready? Let's get this thing off. All right, it's gonna be a little bit noisy, but remember, watch this. The blade itself just oscillates. It shakes back and forth really fast, okay? It doesn't spin around like the kind of saw that maybe your dad uses to cut wood, right? Okay, all right, let's try it. See this? You ready? Okay. Good job. One more side. Okay. Almost done. You did it. High five. That's awesome. Very good.
I didn't feel well.
But you did it. Okay, so now we get to put the cast spreaders, and you just pop it open. All this does is going to pop open your cast. Let's see if we got it. Let's see if we got it. Cross your fingers. Let's see if we got it. Yay! Now the reason we cut this side, so we're going to go medial and lateral, is one reason is because if the patient has a fracture, maybe they're just coming in for a cast change or just an x-ray, we want to still be able to keep them in the posterior side of their cast as a splint, maybe when they go get their x-ray, to still support them. that's always a good idea to kind of do. Also, you avoid a lot of bony prominences that way. Okay, turn your leg this way. Okay, good job. So I always just cut the top of the stockinette out and then peel the cast up. So that way they're still supported. So a lot of times when they first come out of that cast, they go to stretch their leg and it hurts because they've been in that same position for a really long time. So this kind of eases them into it, lets it air out a little bit. You want to save your cast?
Yes, like I saved my other one.
Yeah.
But this one's even longer.
Okay, so then we can just cut this out, kind of open it up. Feels good. I want to feel the air, doesn't it?
No.
Still, be real still. All right, so then there's the leg. And then be real still. Be careful with the scissors and little kids. Even though you've got a blunt tip pair of scissors, you know, they move. Kids move quick. So make sure that you kind of keep in control of that. Always lift the tip of your scissors. And then here you have the back end of the cast that can act as like a little splint. But this is how you remove a long leg cast from a young lady, a pediatric patient. Good job.